Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. I'd like to request for everybody to put on mute mode, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk, so please show your beautiful faces in the video. A reminder after the pep talk, please take the online learning cum evaluation test exercises for mastery of learning and have a certificate, a perfect score to get a certificate like this. So the link has been placed in the chat box already. Another reminder, getting 50 OLETE certificates will entitle one to a voucher for a free ROJoson telemedical consultations. Some of you have already availed of this. This is our 88 or 88 pep talk. Last request is please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face now. Okay. One, two, three. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on the enthusiasm and perseverance of everybody. My pep talk today is entitled Rare, Uncommon, and Common Diseases. This is in consonance with the Department of Health Awareness Calendar, in which it has declared National Rare Disease Week on the last week of February. So the empowerment objective is for the lay people to have a basic understanding of the concepts of rare, uncommon, and common diseases and how to apply these concepts in their health management. The Republic Act 10747 states that the last week of February will be in the Philippines will be the National Rare Disease Week, or NRDW. Okay, so this law was promulgated in 2016. So these are some pictures of patients with rare diseases. Okay. The Rare Disease Act in the Philippines, this is the Republic Act 10747. Okay. This is the policy. It is the policy of the state to protect and promote the right to health of the people, including the right of persons suffering from rare diseases to survival and full and healthy development as individuals through access to timely health information and adequate medical care. So this is essentially part of the patient's rights, universal patient's right of all people, of all citizens in the Philippines. So this will include not only the common diseases, but it will also extend to the rare diseases. So this Republic Act aims to institutionalize the care and welfare of Filipino with rare diseases. So the contents of this pep talk will be the following: what is a rare disease, examples, the usual causes, challenges, and when to suspect rare diseases in children, because this is quite common in children, and what are the differences among rare, uncommon, and common diseases. What is the usefulness of knowing the differences among the so-called rare, uncommon, and common diseases, and what are the challenges in these three categories of diseases: rare, uncommon, and common diseases. What is a rare disease? As defined by the Republic Act 10747, it is an inherited, so pinagmana, usually, okay, mana, metabolic disorders, and other diseases. So it can be non-metabolic also, other diseases with similar rare occurrence as recognized or as declared and recognized by the Department of Health upon the recommendation of the National Institute of Health. This is usually, this is connected with the University of the Philippines Health System. But aside from the inherited metabolic disorders and other diseases of rare occurrence, this will exclude yung mga catastrophic, meaning life-threatening, seriously debilitating, and serious and chronic forms of more frequently occurring diseases. So later on, we will define in terms of number the frequency that will qualify a particular disease to be called a rare disease. The definitions of rare occurrence of diseases vary from countries to countries. For example, in the US, it's 1 case in 1,500 population. In Europe, it's 1 to 2,000, mas malaki, mas uncommon. Okay. Japan, 1 is in 4,000. Taiwan, 1 in 10,000. In the Philippines, our lawmakers have defined it as 1 in 20,000. Okay. So talagang rare na rare ito, 1 in 20,000. So if it's 2 in 20,000, hindi na siya rare. It's something probably uncommon. Pero if it's 1 over 20,000, this can be classified as a rare disease. So these statistics to be considered a disease, for a disease to be considered under rare disease, the statistics have to be monitored through a national registry. As I said, the DOH and the National of Health is the one monitoring this and recommending which diseases will be categorized as rare disease. 1 is 1 in 20,000 in the Philippines. So let me share with you the global and Philippine statistics. Globally, there are about 10 to 15% of individuals worldwide, okay, estimated to be affected by rare disease. So very 10 to 15 lang. Then in terms of number, okay, number of rare diseases naman, okay, they have identified 5,000 to 8,000 rare diseases. Okay, and approximately 200 new diseases. Okay, 250 na didiscover nila, 250 new rare diseases being discovered every year. No? So padami na rin ito. No? Okay. So at the moment, it's about 5,000 to 8,000 different kinds of rare diseases. WHO, or the World Health Organization, has a list of more than 500. But all over the world, it's medyo stricto lang yata yung WHO, kaya konti lang. But this one, it has been reported worldwide 5,000 to 8,000. No? As I said earlier, the definition varies from country to countries. So the WHO statistics shows that the prevalence is only 0.05 to 1%. Mababa, no? But as I said, kanina, different statistics shows there are 10 to 15%. In the Philippines, as of 2022, I was trying to look for some data. No? it has a list of 159 rare diseases. Okay. This is being facilitated by the registry, okay, by the Department of Health and also by the National Institute of Health. The 159 will increase as time goes by and as new rare diseases are discovered and documented. These rare diseases have to be documented and has to be declared by the NIH and DOH as falling into the qualification of 1 in 20,000 population. As of 2021, okay, there are, in terms of patient naman, in terms of patient with rare diseases, which could be this 887 could have 2 or 3 similar cases. Okay. So ito yung 159, these are distinct entity, distinct rare diseases. Ito yung mga pasyente naman. Okay. Pasyente, probably pwedeng sabihin natin, with 159 rare diseases, 887. Okay. So as of 2021, this is the number being registered in the DOH. Okay. Examples of rare orphan disorders. I will explain to you what why it's called orphan also. Medyo highfalutin words ito, mahirap maintindihan, mahirap ma-recall, ma-remember, but just the same. Kaya rare nga, maraming mga queer na mga pangalan. Pompe disease, Gaucher's disease, maple syrup urine disease, Fabry disease, mucosaccharide, polysaccharide saccharidosis, MPS. So in the Philippines, so far, the maple syrup urine disease is quoted to be the most commonly seen rare disease in the country. You're familiar with Down syndrome, or the commonly known as Mongolism. So it's not part of the, it's not really that common, pero it's not considered as a rare disease because it occurs in 1 in 800 population. As I said, to qualify under rare disease, it should be 1 is to 20,000 population. Okay. Mas common itong 1 in 800 population. What are examples of rare diseases? Briefly, ito yung maple syrup urine disorder. Okay. So it's called maple syrup disorder because the patient's body and urine smell like maple syrup. It is a genetic and metabolic problem, and it's the most common rare disease in the Philippines, affecting 1 in 40,000 people. Okay. So pumasok na siya doon, di ba? 1 is 20,000 is the cutoff. So 1 is 1 in 40,000 people. Okay. Maple syrup urine is not fatal when detected in an early age, when the baby is still in the mga days old lang, but it is a lifelong condition that needs special diet. May special diet sila with protein intake carefully calculated. Okay. So symptoms usually consist of vomiting, lack of energy, developmental delay, okay, avoiding foods, and then ito yung pinaka-telltale sign of this particular disease, the urine smells like maple syrup, and if left untreated, maple syrup urine disease can lead to seizures, coma, and death. So this is an illustration of a patient with maple syrup urine disorders. Another example of a rare disease is the so-called mucopolysaccharidosis. So the symptoms will be, the signs will be facial features like flat nasal breeds and thick lips. Thick lips, iba-ibang itsura nito, no? Okay. Short torso and hearing loss, dysplasia and abnormal bone size, iba-ibang size ng bone. And then developmental delays and mental retardation, enlarged organs like the heart, liver, and spleen, and also heart diseases and respiratory issues. So maraming problema yung in this particular patient with mucopolysaccharidosis. Examples of rare disease not categorized as genetically inherited metabolic disorders. Kanina sabi ko, majority will be genetically inherited metabolic disorders, but there are some which are not. Okay? So example will be autoimmune disease, and then rare congenital birth defects, and then the rare tumor, or which could be benign or malignant. Okay. So as long as the incidence of this one, may mga autoimmune disease that occurs in more frequent than one is 20,000 population, then it's not considered as a rare diseases already. Okay. So, but if these three conditions, these diseases will occur in the proportion of 1 is 20,000 population, okay, whether there is a genetic background or not, then it is called a rare disease. Okay. So tandaan na lang natin muna yung definition ng rare disease in terms of this 1 is to 20,000 population. Majority of rare diseases, okay, the usual causes, okay, majority of the rare diseases in the Philippines and globally are due to genetic origin, gene ang problema, particularly inherited metabolic disorders. This has been quoted to be at a high incidence of 70 to 80%. And majority affect the children, usually at birth. Okay, kung minsan hindi lang na-notice, patient grew up, and then subsequently the rare disease is discovered. Okay, so affecting the children in about 50 to 70% of cases. And then about 30% of patients with rare diseases, yung mga bata, usually die before the age of 5. 30%. Medyo mataas din yun. No? Now, what are the challenges of rare diseases? Since it's rare, we have limited information, okay? And so there's a tendency to be not recognized early, to be misdiagnosed, not only by the doctors, but also by the patient, by the relatives. So trying to diagnose them entails a lot of medical consultations and procedures leading to a lot of medical expenses. Kasi very rare, so maraming pagsusuri ginagawa just to prove, just to discover the cause, and then possible treatment that has to be done. So usually magastos, okay? So rare diseases are tough to diagnose because most doctors don't see them often and not familiar with the rare disease. Okay? So nahirapan din sila mag-diagnose, okay? The other challenge would be the characteristics of rare diseases usually include the following. They are often chronic, matagalan, and then progressive, okay, degenerative, and life-threatening. They have a high level of pain and suffering for both the patients and their family. And they are disabling while compromising a patient's quality of life due to lack of or loss of autonomy. Rare diseases are difficult to diagnose, difficult to cure. Okay, so they often face a long journey from diagnosis to treatment. So this essentially is the main challenge of rare diseases among the patients. So Filipinos born with rare diseases, earlier I told you I'm going to explain what is it. It's also called an orphan disease. Rare diseases is also called an orphan disease. Okay, so it's called an orphan disease because these patients suffer from the social abandonment because of lack of existing network of support to aid them. Okay. Kaya tinayo yung RA, yung law, to come out with the systems in which these patients will get more support, okay, from the government as well as from the private institution. Medical help is elusive under the conditions of the country's health priority in the Philippines, okay, but this is also true in other countries. The nature of their illness is hardly known due to lack of information. Kulang pa kasi very rare, kaya marami pang di alam. Maraming bagay pa hindi natin alam. And only a few medical professionals, particularly in the country, in the Philippines, are aware of these disorders and know how to diagnose and address these conditions. To tell you honestly, ako rin, mahihirapan dito. If I encounter a rare disease, mahihirapan din ako. Okay? Especially, I'm not a pediatrician. Okay, marami dyan, puros bata. How to identify the rare diseases? So in recent years, yung mga gene, because as I mentioned, majority are due to genetic disorder. So gene panels, microarrays, and exome sequencing have helped to identify the molecular cause of such rare and undiagnosed diseases. These technologies have allowed diagnosis for a sizable portion, about 25 to 35% of undiagnosed patients, often with actionable findings. Okay. So even with this genetic testing, mahal na rin yan, no? Okay, medyo mahal. Okay. And then fortunately, may nakakatulong na sila in 25 to 35% of patients. The newborn screening, okay. Oh, everybody has heard about the newborn screening, no? Okay. The newborn screening and rare disease newborn screening is one method for screening for detection. Okay, so the newborn screening is one method. Makakatulong siya, no? But not all, because the newborn screening includes other diseases. So it's aimed at early detection of infants with genetic, metabolic, and infectious conditions, not only those rare diseases, but other more common diseases. So kaya hindi lahat, it's just one method. Person with rare disease shall be considered person with disabilities in accordance with Republic Act number 27277 as amended, or the Magna Carta for disabled person. There are PhilHealth packages for rare diseases. Because of the Republic Act, these are the things that came out to support the patients with rare diseases. They can be considered as PWD, and then there are PhilHealth packages. But of course, the funds are really still limited. Newborn screening, as I mentioned, this includes screening of 6 disorders. Congenital hypothyroidism. This is not a rare disease, but it's a uncommon disease. But if left undetected, it can lead to more problem when the boy or when the child grow up. Congenital adrenal hyperplasia, phenylketonuria, galactosemia, glucose 6-phosphate dehydrogenase deficiency, and maple syrup urine disease. Ito yung kanina na-identify natin as one of the more common or most common rare disease in the Philippines. So napasama rito sa, it can be detected by newborn screening. So the others are not strictly speaking, are not really rare disease, but uncommon disease, but which are very important to diagnose and discovered early para hindi maging crippled yung bata when they grow up. So how do you suspect rare diseases? Suspect rare diseases in children, particularly, okay, newborn to toddler years up to preschooler, when there is something unusual in the physical and mental health. So that's the simplest advice that I can give. No? And then have the children check right away by a pediatrician. Kasi bata, no? Usually pediatrician. And then you can choose some pediatrician who are known to, who are now expert. There are pediatricians who are really expert on rare diseases already. So you really have to identify this specialist. Now, if there is such a thing as rare diseases, kasi rare, so there must be common and uncommon diseases then. No? Okay. So we will go beyond the RA, the Rare Disease Act now, okay, and extend this discussion into other diseases that we encounter in a day-to-day basis. Okay. So kung mayroong rare disease, meron ding common, meron ding uncommon diseases. Okay. So if rare disease in the Philippines is defined as frequency of 1 in 20,000 population or less, okay, so then it follows, so we just have to accept that definition because it's already a law. Then using that as a baseline definition, then it follows that a disease whose frequency is more than 1 in less than 20,000, say 1 in 10,000, 1 in 5,000, this is not considered rare disease anymore. Okay. So it could be common or uncommon depending on the statistics. Okay. So at the moment, there's no cut-off frequency. Dito sa rare disease may cut-off. 1 is 20,000. At the moment, there's no cut-off frequency to say that this particular disease is common and uncommon. Walang definite. Okay. So probably mga ano lang by gut feel na lang, no? Okay. Or just put everything in a what do you call that? In numbers, okay? So common diseases are those that occur in large number. Uncommon and rare diseases are those that occur in smaller numbers. So itatabulate mo lang yung statistics, okay? And then one just to tabulate the frequencies to determine the answers. Okay. So comparing all the diseases, kung ano yung which one has the highest number, okay, probably you can say that's the most common. And then yung mga number 10, number 20 could be less common. So what is the usefulness of knowing the differences among rare, uncommon, and common diseases? Number one, it helps in the diagnosis, clinical diagnostic process. For example, if the symptoms and signs of have the same pattern for 2 or 3 diseases, the primary suspect should be one that is most common or more common rather than the less or the least common. Okay. So, pag meron dalawang sakit presenting with the same symptoms and signs, and then as physicians, now we have to decide which one is the most probable diagnosis. We base it on which one is more common. So we choose the most common one as the primary diagnosis rather than the least common. So that's what is meant by help in the clinical diagnostic process. Or for those who have been attending my lecture, my pep talk on the patient management process, the clinical diagnostic process, we use two processes. One is pattern recognition and prevalence. Okay. So prevalence is this part. Now we choose the diagnosis that is more common. The other usefulness of knowing the differences among the rare, uncommon, and common diseases lies in in public health management sa mga government, na? Okay. So, for example, the government has to prioritize health programs for the more common diseases rather than the rare diseases because usually there's a constraint in the resources. Kaya inuuna muna yung mga common diseases. But fortunately, the government also provided some funds for the rare diseases like the RA, the Republic Act. The other challenges will be rare and uncommon diseases may be difficult to recognize and diagnose, and they usually undergo a lot of consults and tests before the diagnosis is established, kaya napapamahal. Okay, may be difficult to treat. Okay. Majority will be difficult to treat, but let me tell you that fortunately there might be some rare diseases that will be easy to treat. Okay, hindi lahat, but majority will be difficult to treat. And of course, majority will entail more cost in medical management, especially when trying to diagnose it. Maraming test ginagawa, no? Genetic testing. And then when it comes to treatment, ganun din, mahal din, no? Okay. Now, in contrast, common diseases may be difficult to decrease. Ang problema ng common diseases, it may be difficult to decrease the burdens of the diseases in the community. Example, yung mga cancer of the colon, cancer of the breast, and taas-taas ang statistics, these are common, but this is difficult to bring down. Okay, so yan ang differences among the rare and common diseases and common diseases. Okay, in terms of difficulty in diagnosis and in terms of decreasing the burden of the diseases. So summary for this particular pep talk. I have discussed the following: what is a rare disease, what are examples, the usual causes, challenges, when to suspect rare diseases in children, children lang muna. Okay. I will not discuss yung mga in adults. What are the differences among the rare, uncommon, and common diseases? What is the usefulness of knowing the differences? Bakit natin pinag-uusapan yung rare, uncommon, and common diseases, which could be which will be important in your patient empowerment program and how you can manage yourself. What are the challenges in these three categories of diseases: rare, uncommon, and common diseases? So takeaway in relation to patient empowerment: be always in touch with reliable medical information on rare, uncommon, and common medical diseases. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan, to gain greater control over decisions in the cases of rare, uncommon, and common medical diseases. So with that, I end my pep talk. I hope I have empowered you to have a better basic understanding of the concepts of rare, uncommon, and common diseases and how to apply them in your health management. So before we go to the QA, question and answer portion, reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. And then 50 OLETE certificates will entitle 1 to a free voucher for ROJoson telemedical consultation. And then reminder also, please place your feedback on the chat box during the open forum and before we adjourn. And then let's now have a group picture taking. Okay. Everybody show their faces, beautiful faces. Christy, Chris Nesesha, are you sleeping?
No, hello Doc. Good afternoon.
Show your face. Yan pala ang sikreto.
Share kami ni Inay.
Okay, sige. Yan pala ang sikreto. Ito para makita yung mukha niyo. Just ask the questions. Are you sleeping?
Share kami ni Inay.
Okay, 1, 2, 3. 1, 2, 3. Okay. Thank you. And save ko lang muna.
Ang gawin mo.
Okay. So the floor is now open for questions, comments. Kung meron kayong experience, share na rin ninyo. Mas maganda para may tayong new information, no? That I can learn from you, no? Okay. Any questions? In-extend ko lang yung lecture today. If I just focus on the rare diseases as defined by the DOH, by the Republic Act, medyo boring, di ba? Okay. In-extend ko lang sa the application of the concept in yung mga diseases that we have every day. Okay. So, ang unang tanong ko sa inyo, if I can ask you, no? If you were to get sick, which one do you prefer? Yung rare or yung common disease? This is a big question that you have to think. If you were to get sick, kung talagang kakasakit ka, anong gusto niyo? Rare or common? Who wants to take a crack at that? Pag-isipan ninyo. Belet del Rosario.
Sa akin po ay common para madali pong magamot. Sa yung rare ay very magastos.
Pero hindi lahat ng common ay magagamot ng successfully, no? Hindi rin lahat. Pero chances are, yeah, magagamot, no? May mga gamutan, no? Okay.
Okay po.
So, any other answers? Walang may gustong rare disease? Jeng? Ano sa'yo?
Common po, doktor. Siyempre po, at least, pag po common, alam na po nung doktor yung pwedeng gawin sa kanya na kung paano gagamutin kesa po dun sa rare.
Okay.
Dok, may na-experience ako dati, kapitbahay namin sa Laguna, bata pa kami.
Okay.
Sa family nila, madami kasi magkakapatid, parang 10 ba?
Oo.
Yung mga nahuling anak, ano siya, before magbinatilyo, namamatay sila kasi pagdating ng 10, tanda ko talaga yun kasi kapitbahay namin,
Okay.
naliit yung kanilang binti. Ito muna yung unang nangyari, yung isang anak na naka-experience ng ganun.
Mhm.
Pero talagang doktor, ano siya, para siyang namamayat yung binti, tapos nalaki yung mata, tapos yellowish yung kanilang balat.
Mhm.
Yun po yung unang namatay. Tapos yung po mga sumunod na dalawa, ganun din po. Parang
Mhm.
iisa sila ng pangyayari. Pero parang hindi naman po siya congenital. Kasi po, yung mga kapatid na babae, okay naman. Pero yung mga lalaki ay nagkakaganon sa kanilang pamilya. Yung kanilang family lang po, yung kanilang mga pinsan, hindi naman.
Mhm.
Kaya parang hindi ko po maisip kung saan siya i-categorize, kung yun ba po ay congenital, kung inherited kasi wala naman po sa family nila, o talagang meron lang po silang sakit na hindi na po nabigyan ng treatment ng magulang kasi mahirap lang.
Mhm. Kung okay, let me try to get to analyze. Kung lahat ng lalaki, lahat
Yes.
ay lalaki,
Opo,
okay.
lahat ng lalaki.
So yung babae, mga babae,
Kasi syempre sa probinsya, sasabihin nila, sinumpa, kasi may mga lalaki ganun. Na syempre, meet lang po yun. Pero siguro po, ngayong nung naisip ko, baka siguro, hindi na po din lang napatingnan nung magulang yung mga bata. Kaya hindi na po sila na-extend yung buhay. Tas, basta ganun po sila. Nakakalaro ko po talaga sila. Talagang yung kanilang katawan naliit dun sa edad na kailangan ganun ang build nila.
ilan lalaki yon?
Tatlo po sila.
Tatlo.
Mhm.
Sa lahat namatay eventually.
Okay, namatay po sila. Pero hindi po sila halimbawa po ang panganay lalaki, babae sumunod. Basta po pag lalaki, ganun po yung nangyayari sa kanila.
So, may pattern na yan kasi kung lahat ng lalaki kasi may tinatawag na doon sa sex chromosome related na. So pag may may mga sakit na lalaki lang tinatamaan na.
Opo.
Okay.
Opo, lalaki lang po talaga sila.
So yung mga usually genetic yon. Genetic yon, no? Okay.
Okay po.
So pare-pareho yung mga simptomas nila, lumiliit ang paa, no?
Mhm.
Okay, so genetic yon related to the sex gene, sex na gene na Y chromosome yon, no? Okay.
Opo.
So hindi na diagnose kung ano, no? Hindi na
Opo,
diagnose, no? So kung na-diagnose, so it will be considered a rare disease only kung na yung frequency is 1:20,000, no? Okay. Okay. Pero mind you, yung 1:20,000, guide lang yon, ha? Okay. What's more important, whether it's rare or not, basta gamutin na lang, di ba? Huwag nating no?
Yes.
Yung categorization 1:20,000 is for the government program lang yon no? Government program para mapasali ka dun sa packages ng okay? Pero in the end, ang challenges is how to treat these patients with rare disease, di ba? Okay. Okay. So most likely genetic yon, no? Sayang hindi na yung first one pa lang sana na-discover na, no? Kung ano, baka na-save pa yung the answer.
Yung dalawa po, yung dalawang
yung dalawa, no? Okay. Okay, thank you for sharing. That's a good example of possible rare disease, no? At we can use yung mga lessons there. Basta yung 20,000 proportion, don't give too much importance on that. Theoretical lang yon, academic lang yon. Okay? Okay. Any more comments, sharing of experiences? But in the end, whether it's rare, common, and uncommon, sana hindi, no? Sana hindi tayo tamaan, di ba? Pero hindi mangyayari yun, di ba? Okay. So you just wish kung ano mang sakit na makukuha natin, no? Just pray and hope that it's something that is curable, kung pwede. If not curable, at least makokontrol. Okay? And then also pray and hope that ma-diagnose na early, okay? And magamot ng maaga. Okay? Ganon, no? So I think that should be the attitude, no? Okay, that we have to adapt. No? Okay. Any more comment? Wala? Maria Justa, Palotan. How do I call you? Yeah, you raise your hands. Yeah.
Ay, Husta na lang po.
Justa, not Maria. Okay. Justa, okay. So
Ako.
you have experience with mga kids mo sa children sa school?
Sa amin po, wala naman po. I mean, like, we have yung may maano ho, like autism, ganon. But that's not uncommon.
Yeah. Yeah,
become-
it's not categorized as uncommon. That categorized as rare, no? Okay.
Oo, kung ako ho, personally, nung bata ako, I don't think it's siguro uncommon lang. Naging allergic ako sa tubig.
Too big. Too big.
Water.
Okay. Then
Um,
na-outgrow mo?
Inano ho ako, sinunog. I underwent phototherapy.
What? Too big?
Oo, I became, contact ho, hindi naman inom. Contact, I don't know how. Basta
Ah, Contact on the skin?
sa skin. Kaya I could not bathe every day. Yung dermatologist, she actually, parang ultraviolet yata yun eh.
Yeah.
Kasi noon po ito, they didn't know yet about UV causing skin cancer. So
Oo.
I remember being treated that way. She had a light that she held.
Mhm.
Tapos she burned me 3 times a week. I had to go to her clinic and I was burned from the neck
Mhm.
down.
Neck down?
Uh,
Buong katawan?
Oo.
Except
Hindi
the
lang ho
head?
tinamaan. Ang hindi lang ho tinamaan yung my face, my my genital area.
Oo.
But everywhere else, my fingers and toes, hindi ho. Pero
Mhm.
everywhere else, ganun. Kaya ho, I have no body hair.
Okay.
None.
Nobody here because of the UV violet.
Oo.
UV
If you,
light.
talagang ano ho, as in, tas minsan, once in a while, I itch, pero nawawala naman.
So,
There is,
at what age is that?
second year high school yata ako ho eh. So I was what? 17, 16, 14 or 15 ho.
Okay. So, anong diagnosis binigay sa'yo?
Yun lang ho ang sabi. She told my mom and my parents, allergic daw ako sa tubig because it would happen after I would take a bath. So, so, yun po.
So, kung allergic ka sa tubig, palitan ng tubig.
Oo,
Just, parang mag-ano ka na lang, yung mga bottled water ka na lang.
oo. Yun, nawala naman, nawala. I mean, it stopped na. I bathed already. I've been
Yeah.
bathing.
Baka
Yun nga lang.
in retrospect, bakit UV,
Oh, yun ho. That's I remember. Yes. Strange nga ho eh.
Oo. Kasi kung if you have the problem, you try to identify the cause if you can, especially if it's due to yung mga environment, due to exposure, gano'n, no? So tatanggalin mo lang naman yun, change of environment, try it out, no? Rather than
Oo.
instituting yung mga treatment, yung mga machines, no? No?
Oo.
Kaya ang side effect niyo, wala kang buhok.
Oo, wala ho. I mean, only on my head and but
So okay lang
As
sa'yo,
in-
walang buhok?
dito na lang yung ulo ko. Tinamaan.
Sa kilikili, wala ring buhok.
Wala rin po. Wala. Weird nga ho. Kaya
Okay,
Pero,
so
that's
side effect ng UV. Okay.
I
So
guess so.
anyway, okay, so yeah, that's why it has, kung ganon, if you're telling me the alsa water, it could be a rare disease, pero baka in the end, it's not.
Oo.
No?
Tapos parang allergy daw ho
Allergy
eh.
lang, no?
Allergy ang sabi niya eh. So, kasi
Have you heard of other people having allergy to water?
I researched it all much later on, only fairly recently.
Oo.
Ang nakita ko doon, minsan you undergo a viral infection that makes you allergic to water. Ay, wala naman ako naaalala ng viral infection ako noon. I would remember if I had a viral infection.
Okay.
I-
So pero yung viral infection is yan ang unang yan ang unang cause. And then after that, when you're exposed to the water, nagka-clear
Oo.
up. Ganon.
Yun yung pasa ko. Kasi
So,
I tried to research nga ho eh. Pero
so not water by hindi yung water itself causing the problem.
Oo, the virus, whatever virus that was.
Yeah. Kasi kung
Hindi ko
water,
Na-
sasabihin natin sa Nawasa, sa Maynila, napapalitan nila yung water.
Oo. Kasi ho, noong time na yun, kasi we live in Parañaque. Alam niyo yung Parañaque, Gobi of the Philippines. Wala talagang tubig, lalo na noon.
Oo.
Ngayon nga, pero noon talaga, we had no water, we had no access to Nawasa. So we had to either buy water
Yeah.
or we would dig our own deep well.
Okay.
So that was basically the water that we used for decades. So baka baka that kind of water kaya.
Pwede, kasi yung water naman maraming may mga impurities yan, di ba? May maraming chemicals din yan. It can cause some problem, di ba? It can
Baka
cause,
yun.
kaya tayo nag-ship nga, kumisa marami tayo nag-ship sa di ba? Bottled water, distilled water, etc. No? Okay. So it's possible, but we just have to identify which one is causing the problem, di ba? Inside the water, di ba? And try to avoid it, na? Okay.
Yes. Wala na naman ho, after that na bakbak and then wala na, it did not occur again.
You have a picture? Your picture of your skin?
No.
Wala, hindi pa uso yung mga selfie.
Ano lang ho siya? Ano siya? Rashes na Makati. Rashes ho siya. Red. Yan ang naalala ko. Red rashes na mahaba. Medyo strips ho. Na, well, maybe because I was scratching them.
Okay. So, okay. Thank you for that sharing. But okay, extend natin to make the discussion more interesting. Pag allergy, di ba? Kung allergy tayo sa, let's say, eating something, no? Allergic reaction tayo, no? So when do you consider that as a rare disease? Yung allergic reaction to food intake. Karamihan ng mga population, pag kumain ng isang pagkain, na allergic reaction, most likely it's not a rare disease, no? Okay. So, but if we can identify a particular substance, no, na pero I don't think it will be classified as rare disease. No?
Hindi ho kasi allergy daw.
Allergic reaction kasi depende sa sistema ng katawan. But once you avoid it, wala na eh, di ba? Ano? So, probably allergic reaction sa pagkain, most likely baka hindi siya applicable. Pero yung mga sa gamot, pwede, no? Let's say itong gamot nito, pag binigyan mo, it occurs in yung classification sa gamot, ibang classification sa gamot, ha? They have a classification common, uncommon, rare, ganun din, no? Sa mga reactions sa gamot, no? So pag sa gamot naman, let's say 1 is to 10,000, they call it baka uncommon. 1 is to 1,000, very common na yon. Let's say for every 1,000 inject mo yung gamot na yon, kakaroon ng allergic reaction, no? You can categorize it that common, uncommon, ganon. Pero the number is smaller, yung proportion, no? Okay. So sa pagkain, baka meron, pero it's rare that we talk about rare diseases, allergic reactions sa pagkain, no? So sa mga gamot, meron, no? Kaya parang kahit na maliit, allergic to penicillin, di ba? Allergic to penicillin, before it was rare, but after a while, it became more common, kaya meron ng mga precaution, wag na mag-penicillin kung meron kang history of allergy, no? Ganon. Okay, so that's how you apply this concept, no? Kaya in-extend ko yung rare disease na pinopromote, yung sineselebrate natin, awareness for February, last week of February, in-extend ko lang sa how we can apply it to other diseases, no? Okay.
Buti na lang ho, di na umulit.
Okay. Pero okay. So I'm interested kung sana may diagnosis ka, no? Wala kang diagnosis, eh, no?
Oh, that's a long time ago. I was still, very young. I would just kung ano yung sinabi ng doktor. Gano'n na lang. Siyempre, wow.
Okay.
Very, very itchy ho. That I remember very well. It was extremely itchy. And
Yeah.
I would scratch ho talaga until talagang
Allergic reaction lang yan. Pero buhay pa ba yung derma mo?
Hindi na ho. Doktora Arcilia ho? Would you know her?
Sia?
Doktora Arcilia.
Arcilia, I don't know.
Matagal no? She was also the mother of one of my classmates. So,
Okay.
ago.
Kasi I was thinking baka pwede namang tanggalin yung source. Pwedeng hindi gamitin yung UV, di ba?
Never mentioned. I was just treated. I don't think I took anything or applied anything. Basta po, and then after that, on the day of the treatment, talagang walang contact with water.
Okay.
I could not bathe or wash or anything. Talagang medyo mahirap.
Okay.
Yun. And then, okay lang. The day after, pwede na. Then, ganun ulit.
Okay. Thank you for sharing, Husta.
Opo.
So to everybody, ano yung pinaka-common sakit ninyo so far at this age? Anong nararamdaman ninyo? Which you think is the most common? Headache? Headache yung pain. Pain is most likely the most common, di ba? Pains kahit saan. Pero which part of your body? Headache. Sa shoulder. Kibelet. Shoulder. Headache.
Lower back pain po, Doc. Lower back.
Okay. Arthritis na yan. wala ka masyadong headache, baka nakokontrol mo yung stress mo sa pag-iisip. Okay. So anybody wants to share on that? Anong pinaka-common na okay, in terms of sakit ng katawan? As I said, most likely it's pain, no? But which part of the body is commonly affected by the pain? Headache, arthritis, ano pa? Yan ang problem, pinaka-common, di ba? Headache, arthritis.
Opo.
So kung dalawa, good luck. You try to control which one. Mas madali yata i-control yung headache kaysa yung arthritis. No? Arthritis comes with age. Kung minsan mahirap i-control talaga yan. Di ba? So you just have to do exercises. Okay. Exercise na mahirap gawin pero libre naman, di ba? So hindi magastos, di ba? So you just do your exercise, stretching, flexing exercise every day for the rest of your life, di ba? Mahirap gawin, kaya lang, pero mura, walang bayad, di ba? Okay. So don't rely too much on medications, no? Okay. Okay. So it's 3:04. Any more comments, questions? Nana? So next week, I'm planning to talk on colorectal cancer awareness month. No? Okay. Kasi this month, March, we're celebrating the colorectal awareness month. No? Wala pa yata tayong lecture on colorectal before. No? Okay. Okay. So if there are no more questions, we call it a day. Nana? Okay.
Thank you po.
Bye-bye. Bye-bye.
Salamat po.
Bye-bye.
Bye-bye po.
Thank you.
Thank you po, Doc.
Thank you po.
Mayan, kausapin kita mamaya. Mayan? 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 Mayan, Jose? Wala si Mayan. Mayan? Wala. Okay. Then kausapin ko si Mayan kasi yung isinabit niyang mga members of the BSE. Ika-clarify ko lang sa kanya. Okay. So, goodbye. See you next week.